Okay, so tell us about the different treatment options outside of surgery. Are those all non-surgical?
I would start with EOS first.
Okay.
So talk about diagnosing specifically
Mhm.
that technology that we have, and then move into
So here at OIC, we're fortunate to have a state-of-the-art X-ray imaging system designed specifically for scoliosis. There's several advantages to the system, one of them being that the radiation dose necessary to obtain high-resolution imaging is much lower than traditional X-ray machines. In addition, there's some complex software processing that allows us to do 3D analysis of scoliosis, because scoliosis really is a curvature in multiple planes. So to be able to best assess the deformity, we use this imaging system to both monitor scoliosis as well as to plan for surgery.
Okay, is that here? The
Yes.
X-ray machine?
Yes.
It
So
is.
maybe we could get
Yep.
enrolled in that too. Okay, so the other two now?
Yeah.
So the surgeons and providers of scoliosis care at OIC are skilled in not only surgical treatment for scoliosis, but the non-operative or conservative care. One of the growing areas of interest in treating scoliosis in a non-operative way is to use serial casting. So in the youngest children, infants and toddlers who have scoliosis, surgery isn't a great option. But we do have the option of doing and applying casts on a regular basis that are applied with a special cast table and a technique. So this meta-type casting can not only prevent progression, but in some cases lead to improvement in and resolution of scoliosis in the youngest children. So we do that here at OIC.
Then talk about the magic rods.
Magic rod.
Oh, yes. Children who have scoliosis and are younger need to continue to grow. We want their trunk to become adult-sized. But unfortunately, that sometimes comes in conflict with the need to treat severe curvatures of the spine. So fortunately, there is new instrumentation that has been developed in the last few years that allows us to control curves, but also allow for growth. One of these unique special devices is called the magic rod. And the magic rod has a magnetically controlled system that once installed, we can then lengthen the rod with a magnetic computer-controlled device that allows us to avoid multiple general anesthesia, surgical procedures where traditionally we've had to open up and access the instrumentation to expand it or lengthen it. So this is really, I think, a game-changing instrumentation that the surgeons here at OIC use with regularity.
Does the child feel that when you do expand it?
So when a growing rod is lengthened under this magnetically controlled device, we typically see little discomfort or pain during the expansion process. And fortunately, this device is precise so that we can measure the amount of length and also monitor any type of response or changes for the child. So it isn't one of these all or nothing type processes. So if there is any discomfort, we can immediately stop or adjust what we're doing.
Okay. And I have a question about surgery specifically. How do parents usually react when you tell them your child needs surgery, and how does the child usually react? Because spine surgery that's scary for people, I imagine.
Yeah. So parents' reaction to the news that their child has scoliosis that's large enough that surgery is recommended, can react quite differently in terms of how, what does this mean? I think many parents are concerned about if they're undergoing surgery, will their child have pain? Will their child how will this disrupt their usual routine attending school? How long will they be having to be kept out of sports or other activities? And it's important to know that most cases of scoliosis do require some time out from school and activities, but the vast majority of patients will return to full activities and get back to school in a short period of time.
Okay.
Great.
So this is an x-ray of a patient who has a typical form of idiopathic scoliosis. And we measure the curvature based on the tilt of the segments here. When that angle measurement exceeds 50 degrees, surgery is generally recommended. And the reasons for that is that scoliosis has a high risk of progressing even after growth has stopped. So in order to achieve a better alignment of the spine and to fuse the spine, we do surgery that involves placing of screws, hooks, and rods that hold the spine in a straighter position. That segment of the spine will then be stable and will no longer bend or move. And that prevents future progression of scoliosis.
How did you end up specializing in this?
Great.
So I chose to specialize in scoliosis care after pursuing a secondary training in pediatric orthopedics. And it's the desire that I have to have the biggest impact on a child who has a condition, in the case of scoliosis, that can be life-altering, both in terms of their function, breathing capacity, but also their concerns that they may have about their appearance. The surgery itself is quite satisfying, taking something that is curved or abnormally positioned and straightening it. But most importantly, I think that this is a surgery where we can really make a difference in a child's life. I've been inspired every day by the children who have scoliosis in their willingness to participate in their care, whether it's wearing of a brace to prevent the progression of scoliosis, or their willingness to undergo surgery to be able to see kind of how this can have such a significant impact on their future.
Okay, great.
That's good.